Do you think that Canada has the second best healthcare system in the entire world? Take a look at this clip with Federal Health Minister Mark Holland.
There's a report out very recently citing that Canada's the second best healthcare system in the world.
You can find a study that shows just about anything, but the government's own data, as well as countless news stories from across this country, show that our system is failing right now. Data obtained by secondstreet.org from provincial governments and hospitals and health regions across the country shows that over 17,000 patients died last year alone while waiting for various surgeries and diagnostic scans. There's countless suffering going on out there in this country right now. The data shows that many patients are really struggling in their final years while they wait for the government to provide care. Patients are living with chronic pain while they wait for knee and hip operations. They're walking around with cloudy vision while they wait for cataract surgery. Many are actually dying while waiting for surgery that could potentially save their lives. Heart operations, cancer treatment, and more. The stories are absolutely brutal in this country. In BC, the government simply gave up on cancer patient Alison Duclazo. They even offered to help her end her life. Thankfully, she ignored the government's offer and she went abroad for surgery. Today, she's back paddleboarding, she's golfing, she's picked up running again. She's living her life, no thanks to BC's government. In Ontario, we spoke with a retired nurse, Judy Anderson, and she described how she's lost not one, but two daughters due specifically to long wait times in the healthcare system. Stories of patients suffering are all too common in this country, but Canada's federal health minister thinks that patients need to just be more patient. Take a look at this.
I would say to folks, most of the waiting that is occurring is for either elective procedures or for procedures that are not in an emergency circumstance, that people be patient with those. I know that's hard.
How many more decades do we have to spend playing this silly game where governments throw more and more money at the healthcare system and everyone else is supposed to just sit back and hope that somehow the system improves? In 1993, government spent $1,688 per person on healthcare in Canada. 30 years later, in 2023, government spent $5,748 per person on healthcare. Yet during the same 30-year period, wait times increased from about 9 weeks to over 27 weeks. More money, longer wait times. The government's approach has failed. Now take a look at some of Minister Holland's comments about private health care.
Private care is not the answer. Health systems that have operated on this model are an abject disaster.
What people are saying, including our own think tank, is that we should keep our public universal healthcare system, but find ways to improve it. And at the same time, give patients a choice. If they don't want to use the public healthcare system, let them pay out of pocket privately for surgery. Every time this happens and a patient is willing to spend their own money, well, they're taking pressure off of the public healthcare system. Now, when you look at countries that perform better than Canada, countries like Sweden, Norway, Australia, New Zealand, France, the United Kingdom, the list goes on, they give patients that choice. And it's one way that they can end up reducing wait times. Respectfully, Minister Holland, it's time to stop the rhetoric. It's time to put patients first. It's time for health reform so that we can actually start to see some changes that can improve results for patients instead of the same old tired approach of throwing money at the system and hoping it works.